Hello everyone, now let us discuss about 2023 CPT coding guidelines for immunization administration for vaccines or toxoids, part 2. This comes under medicine chapter of CPT. In the current session, we will be discussing all other vaccines other than the COVID vaccines. So, as we have discussed earlier, vaccine coding requires two codes, a minimum of two codes. One is administration code, the next is product code. Each vaccine will have a specific admin code and a specific product code. When coming to administration codes, there are two types of codes, pediatric codes and the next are adult codes. Pediatric codes are 90460 and 90461. They should be coded only when the patient age is below 18 years. And second point, there should be a face-to-face counseling. Provider or other healthcare professional should provide face-to-face counseling of the patient or family during the administration of vaccine. Then only you can code 90460 and 90461. And for age above 18 years, you need to code 90471 to 90474. And there is one more scenario that we'll discuss in the next slide. Here we will be discussing the various scenarios for the selection of admin code. The admin code depends upon two factors. The first one is age and the second one is counseling provided by physician or other qualified healthcare professional. First one is age. If the patient is below 18 years of age and above 18 years of age. For below 18 years of age, you need to generally use 90460 and 90461. And for above 18 years of age, you need to code 90471 to 90474. But there is a little tricky part while coding 90460 and 461. Apart from age, the another factor is counseling. If the counseling is provided, there are two scenarios: whenever the counseling is provided, whenever the counseling is not provided. S indicates counseling is provided by the physician or other qualified healthcare professional. If counseling is provided and the patient age is below 18 years of age, then only you need to code the admin codes 90460 and 90461. If the counseling is provided and the patient age is above 18 years, even though counseling is provided and the patient age is above 18 years, you need to code 90471 and 90474 series. And if the counseling is not provided, irrespective of the age, whenever counseling is not provided, even though the patient age is below 18 years, then also you need to code 90471 and to 90474 series only. Whenever counseling is not provided, and for pediatric patient, for coding pediatric vaccines, whenever counseling is not provided, you need to use the adult codes only. This is a ground rule and important point. You should use 90460 and 90461 only when the counseling is provided and the patient age must be below 18 years. Counseling must be provided and age must be below 18 years. Then only you can use 90460 and 90461. Now, additionally, for significant separately identifiable E&M service, it can be either outpatient service, outpatient consultation, emergency department service, or preventive medicine services. Then you need to code the appropriate E&M service code with 25 modifier. And coming to component, a component refers to all antigens in a vaccine that prevent disease caused by one organism. And the components are mainly taken into consideration whenever we are coding 90460 and 90461. When we are coding 90471 to 74, we don't take into consideration the number of components. Only in the pediatric vaccine coding, that too when the counseling is provided, then we will code according to the components. So what is a component? A component refers to all antigens in a vaccine that prevent a particular disease. In a combination there are certain combination vaccines. For example, pentacell. It contains 5 different types of vaccines. So it is composed of 5 components. Each vaccine will represent specific antigen. So pentacell contains 5 components. And coming to multivalent antigens or multi-serotype of antigens. Certain antigens are multivalent. Multivalent is not taken into consider as multi-component. Component is different. Multivalent is different. Multivalent antigens, they prevent only one particular disease. Multivalent antigen or multiple serotype of antigens against a single organism. Multivalent antigens or multi-serotype of antigens against a single organism are considered as single component. This is important. Valency does not indicate the number of components. Multivalent antigens or multi-serotype antigens against a single organism. Here, organism is taken into consideration. Single organism indicates single component. And combination vaccines are those vaccines that contain multiple vaccine components. Conjugates or adjuvants contained in vaccines are not considered as component. This is also important point. The conjugates or adjuvants contained in vaccines are not considered to be component parts of the vaccine. Now coming to various admin codes. The first one is 90461. Immunization administration through 18 years of age. That is up to 18 years of age via any route. Pediatric codes, there are no separate different admin codes for different routes. Any route of administration, if the patient is below 18 years of age and counseling is provided by physician or other qualified healthcare professional, then for the first or only component of each vaccine or toxoid administered, you need to use 90460. For the first or only component of each vaccine or toxoid administered, you need to use 90460. And for each additional component, you need to add this add-on code plus 90461. You'll understand when we discuss the example. So these two are the pediatric codes. 90471 is the primary code for first component or only component. Then 90461 is the add-on code that must be used along with 90460. Next, 90471. Immunization administration includes percutaneous. Here the routes of administration are different. For percutaneous, intradermal, subcutaneous or intramuscular, you need to use 90471 as immunization admin for the first vaccine. And for each additional vaccine, irrespective of the components, while coding adult vaccine, we don't take into consider the components. Suppose 3 vaccines are administered. For one vaccine, you need to use 90471, and for the next 2 vaccines, so total 3 vaccines. For the first vaccine, you need to use 90471. For the next 2 vaccine, you need to use this add-on codes plus 90472. Each additional vaccine, single or combination vaccine or toxoid. This is for percutaneous, intradermal, subcutaneous or intramuscular. The next is 90473. Immunization administration by intranasal or oral route. For intranasal or oral route, you need to use this admin 90473. And this is the add-on code 90474. This can be used along with 90471 or 90473. This is important. And whenever we are coding adult vaccine, only for the first vaccine, you will use 90471. For the next all vaccines, you will use add-on codes only. Now coming to vaccines or toxins. Now here are the list of various product codes. 90476 indicates adenovirus vaccine type 4 live for oral use. The next is 90477 indicates adenovirus vaccine type 7 live for oral use. Next is 90581 anthrax vaccine for subcutaneous or intramuscular use. The next is 90585 Bacillus calmette Glurine vaccine BCG for tuberculosis live for percutaneous use. The next is 90586 BCG for bladder cancer live for intravesical use. The next is 90587 dengue vaccine quadrivalent live 3-dose schedule for subcutaneous use. The next is 90584. This is a new code and this requires FDA approval is pending. Dengue vaccine quadrivalent live 2-dose for subcutaneous use. Next is 90633 hepatitis A vaccine pediatric or adults in dose 2-dose schedule for intramuscular use. The next is 90634 hepatitis A 3-dose schedule for intramuscular use, pediatric or adolescent. Here doses are different. So hepatitis A alone will have different product codes depending upon the physician's documentation. If it is a 3-dose, you need to code 90634, and if it 2-dose, you need to use 90633. The next is 90636 hepatitis A and B vaccine combination vaccine. This is a combination vaccine adult dose for intramuscular use. So for both hepatitis A and hepatitis B, you need to report only 90636. Individual vaccine codes are not essential whenever we are using combination codes. The next is 90647. Haemophilus influenza type B vaccine HIB PRP OMP conjugate 3-dose schedule for intramuscular use. The next is 90648. Haemophilus influenza type B PRP T conjugate 4-dose schedule for intramuscular use. The next is 90649. Human papilloma virus vaccine type 6, 11, 16, 18 quadrivalent 4B HPV 3-dose schedule for intramuscular use. The next is 90632 hepatitis A vaccine adult dose for intramuscular use. The next is 90650 human papilloma virus vaccine type 16, 18 bivalent 2B HPV 3-dose for intramuscular use. The next is 90651 9B HPV human papilloma virus vaccine types 6, 11, 16, 18, 31, 33, 45, 52 and 58. Nona means 9 valent HPV 2 or 3-dose schedule for intramuscular use. 90635 indicates Haemophilus influenza vaccine inactivated subunit adjuvant for intramuscular use. The next is 90654 influenza virus vaccine trivalent split virus preservative free for intradermal use. The next is 90630 influenza virus vaccine quadrivalent split virus preservative free for intradermal. These two are intradermal use. The next is 90655 influenza virus vaccine trivalent split virus preservative free 0.25 ml dose for intramuscular use. 90656 this is influenza virus vaccine trivalent split virus preservative free 0.5 ml dose for intramuscular use. Next is also influenza virus only. 90657 influenza virus vaccine trivalent split virus here the dose is different 0.25 ml dose for intramuscular use. The next is 90658 influenza virus vaccine trivalent split virus 0.5 ml dose for intramuscular use. The next is 90660 influenza virus vaccine trivalent for intranasal use. The next is 90672 influenza virus vaccine quadrivalent for intranasal use. The next is 90661 influenza virus vaccine trivalent derived from cell culture subunit preservative and antibiotic free 0.5 ml dose for intramuscular use. The next is 90674 influenza virus vaccine quadrivalent derived from cell culture subunit preservative and antibiotic free 0.5 ml dose for intramuscular use. The next is 90756 influenza virus vaccine quadrivalent derived from cell cultures subunits antibiotic free. The dose is 0.5 ml for intramuscular use. The next is 90673 influenza virus vaccine trivalent derived from recombinant DNA HA protein only. preservative free, antibiotic free for intramuscular use. Here we will be discussing only couple of examples for each type of vaccine, just for understanding. So you can refer the CPT book for further reference. So the next CPT is 90670, pneumococcal conjugate vaccine 13 valent, PCV 13 for intramuscular use. And for PCV 15, pneumococcal conjugate vaccine 15, the CPT is 90671. And for CPV 20, it is 90677. And for rabies vaccine for intramuscular use, it is 90675. And for rabies vaccine intradermal use, it is 90676. The next is 90680, rotavirus vaccine pentavalent, 3-dose schedule live for oral use. The next is 90681, rotavirus vaccine human attenuated 2-dose schedule live for oral use. The next is 90682, influenza virus vaccine quadrivalent derived from recombinant DNA HA protein, only preservative and antibiotic free for intramuscular use. The next is 90685, influenza virus vaccine quadrivalent split virus preservative free, 0.25 ml dose for intramuscular use. The next is 90686, influenza virus vaccine quadrivalent split virus preservative free, 0.5 ml dose for intramuscular use. The next is 90687. This is also influenza virus vaccine quadrivalent split virus 0.25 ml dose for intramuscular use. The next CPT is 90689. 688 is also influenza virus vaccine. The dose is different. Here the dose is 0.5 ml. The next is 90689. Here it is inactivated, not live. Inactivated adjuvant preservative free. Influenza virus vaccine quadrivalent inactivated adjuvant preservative free. The dose is 0.25 ml for intramuscular use. When the dose is 0.5 ml, inactivated attenuated preservative free influenza virus vaccine, you need to use 90694. The next is 90690 for typhoid vaccine live oral. The next is 90691 for typhoid vaccine Y capsular polysaccharide VICPs for intramuscular use. And 90696 for DTaP IPV diphtheria, tetanus toxoid, acellular pertussis vaccine and inactivated poliovirus vaccine. This is a combination vaccine for DTaP and IPV, inactivated poliovirus. 90696 when administered to children 4 years through 6 years of age for intramuscular use. The next is 90697 DTaP IPV HIV hepatitis B, diphtheria, tetanus toxoid, acellular pertussis vaccine, inactivated poliovirus vaccine, Haemophilus influenza type B and hepatitis B vaccine. This is a combination vaccine which has 4 components: DTaP, IPV, HIV and hepatitis B for intramuscular use. The next is DTaP, IPV/HIV 90698. Diphtheria, tetanus toxoid, acellular pertussis vaccine, Haemophilus influenza type B and inactivated poliovirus. Here there are 3 components. Next is 90700. It is for DTaP alone. Diphtheria, tetanus toxoid and acellular pertussis when administered to individuals younger than 7 years of age for intramuscular use. The next is 90702. DTaP, diphtheria and tetanus toxoid DT adsorbed when administered to individuals younger than 7 years for IM use. The next is 90707. Measles, mumps, rubella virus vaccine MMR live for subcutaneous use. The next is MMRV, measles, mumps, rubella, varicella vaccine. 90710 is the CPT. The next is 90713, polio vaccine inactivated for subcutaneous or intramuscular use, IPV. The next is 90714, tetanus and diphtheria toxoids adsorbed, TD, preservative free when administered to individuals 7 years or older for intramuscular use. The next is 90715, Tdap, tetanus and diphtheria toxoid and acellular petricis. Preservative free when administered to individuals 7 years or older for intramuscular use. The next is 90626. Tick-borne encephalitis virus vaccine inactivated 0.25 ml dose for intramuscular use. When the dose is 0.5 ml, the CPT is 90627. And 90716 is for varicella virus vaccine, but VAR live for subcutaneous use. 90716 is for varicella virus vaccine. The next is 90717 yellow fever vaccine live for subcutaneous use. The next is 90723. It is a combination vaccine, diphtheria, tetanus toxoid, acellular petricis, hepatitis B and inactivated poliovirus. DTaP, HEP-B and hepatitis B and IPD. Next is 90625. Cholera vaccine live adult dose, 1 dose scheduled for oral use. The next is 90632. This is 23 valent pneumococcal polysaccharide vaccine, 90632. When administered to individuals 2 years or older for subcutaneous or intramuscular use. Some more examples are 90744 hepatitis B, pediatric or adolescent dose, 3 dose schedule for intramuscular use. 90746 for hepatitis B, adult dose, 3 dose schedule for intramuscular use. This is adult or pediatric or adolescent. Next is adult dose. The next is 90759 hepatitis B vaccine, 3 antigen, 10 mcg dose, 3 dose schedule. The next is 90747 hepatitis B dialysis or immunosuppressant patient. Dosage is 4 scheduled for IM use. Now let us discuss couple of examples for better understanding. First one is 2 months year old patient presents for her checkup. That is, the patient is coming for annual health maintenance or preventive services. Following vaccines are ordered: pentacell, pneumococcal and rotavirus. The pentacell has diphtheria, tetanus, acellular petricis, Haemophilus influenza B, inactivated poliovirus. DTaP alone will have 3: diphtheria, tetanus and acellular petricis. So pentacell has 5 components, hence the name penta. Penta means 5. So 1, 2, 3. 3 components for DTaP, 1 component for Haemophilus influenza type B and 1 component for inactivated poliovirus. So here the physician is ordering pentacell, 1 vaccine, pneumococcal another vaccine and rotavirus 1 more vaccine. So total 3 vaccines are administered and pentacell has 5 components in it. And the patient is less than 18 years of age and counseling is provided. Physician counsels the parents. So the appropriate admin codes should be 90460. First you need to code the preventive service code 99391. This is established preventive service code for patients age younger than 1 year. The patient age is 2 months. So the appropriate code is 99391. Established preventive visit along with 25 modifier followed by admin codes. First one is 90460. This is given for the first component of each vaccine. So here we are administering 3 vaccines. That is 3 different products. The first product is pentacell, the next product is pneumococcal vaccine and the next product is rotavirus. So 3 vaccines, so 3 first components. So 90460 into 3. First 90460 into 3. 1 component for pentacell, 1 component for pneumococcal and 1 component for rotavirus. 1 unit. 1 unit for pentacell, 1 unit for pneumococcal and 1 unit for rotavirus. First component. For each first component, you need to use 1 unit of 90460. And additionally, this pentacell alone has 5 components. diphtheria, tetanus, acellular peteris, Haemophilus influenza type B, and inactivated poliovirus. So for one component you have used, for the first component you have used one code of 90460 and 1 minus 5 indicates 4. So remaining 4 components are there in pentacell alone. So additionally you will use 4 add-on codes for each component. 90461, this is an add-on code into 4 for the remaining 4 components of pentacell. So the appropriate coding is 99391 along with 25 modifier and 90460 into 3 units to indicate the first component of each vaccine product. The next is 90461 4 units for the remaining 4 components of pentacell, because for one component you have used the 90460. So remaining 4 components you need to use 4 units of 90461, followed by product codes. 90686. This is the product CPT for pentacell, DTaP, HIB, IPV. 90686. Next is 90670. This is the product CPT for pneumococcal vaccine. The next is 90680. This is the product CPT for rotavirus vaccine. Now let us see one more example. A 5-year-old established patient is at physician's office for her annual child examination. So this is also a preventive service and the patient is established patient. Age is 5 years. So the first preventive service code must be coded 99393 along with 25 modifier to indicate preventive service medicine established patient 5 to 11 years of age. And the patient is scheduled to receive her first hepatitis A vaccine, her fifth Tdap vaccine and the influenza vaccine. So here the patient is receiving 3 different products. First hepatitis A, fifth DTaP and influenza. After distributing the vaccine information statement and discussing the risks and benefits of immunization with her parents. That is, the physician is discussing the risks and benefits of immunization. That is nothing but the physician is providing the counseling. After providing the counseling, the physician administers the vaccines. So patient age is less than 18 years and counseling is provided. So the appropriate admin codes will be 99460. Here how many vaccines are administered? 3 vaccines. First hepatitis A, fifth DTaP and influenza. So for the first component of each vaccine, we will use 3 units of 90460. 90460 into 3. For the first component of hepatitis A, DTaP and influenza. Influenza and hepatitis A will have only one component each. So no issue. Next DTaP. DTaP has 3 components. Diphtheria, tetanus, acellular peteris. So for one component, we are using 90460. And for the remaining 2 components, for the second and third components, you need to use 2 units of 90461. 90461 into 2, followed by product codes. So the appropriate coding is 99395 along with 25 modifier. Next 90460, 3 units of 90460, followed by 2 units of 90461. Then the respective product codes. 90633 for hepatitis A vaccine product code, 90700 for DTaP and 90686 for influenza virus vaccine. Now coming to one more example, 19-year-old patient. Here the patient age is above 18 years. Presents to the office to complete a college physical examination. That is, this is also a preventive service and the age is 19 years. So the appropriate preventive service code is 99395. Here this patient is also established patient. So 99395 along with 25 modifier. 99395 indicates preventive medicine service established patient age 18 to 39 years age. Patient age is 19 years. So comes under this bracket. Next is due for tetanus, diphtheria, acellular pertussis, Tdap booster, meningococcal vaccine and intranasal influenza vaccine. Here 3 vaccines are provided and the patient is above 18 years of age. So you need to use 90471 series. So whenever we are coding 90471, here in total 3 vaccines are given. You have to use the code 90471 only once. And the rest code should be add-on codes. Either it can be 90472 and or 90474. 90474 can be given along with 90471 and 90473. Next, so 3 vaccines are there. Tdap, meningococcal, intranasal influenza. So for first vaccine, you can consider any vaccine. The code is 90471, 1 unit of 90471, followed by remaining 2 vaccines. For example, let us consider Tdap as the first vaccine. For Tdap, 1 unit of 90471. Here, whenever we are coding 90471, we don't take into consideration the components. Entire vaccine product is given 1 admin, 90471. Followed by meningococcal vaccine and intranasal influenza vaccine. For meningococcal, add-on code 90472. First 90471 for the first vaccine, followed by remaining 2 vaccines are there. Total 3 vaccines are coded. For 1 vaccine, we will code 90471. And the remaining 2 vaccines, we will code add-on codes. In the remaining 2, one is meningococcal, intramuscular only. The next is intranasal influenza vaccine. For intranasal route of administration, the admin and the add-on codes are different. And hence we are giving only add-on code for this in this scenario. So the first add-on code for meningococcal vaccine 90472, 1 unit of 90472 and 1 unit of 90474. This is for each additional oral or intranasal vaccine. This is for intranasal influenza vaccine. This is for meningococcal vaccine. So here 1 unit of 90471, 1 unit of 90472 and 1 unit of 90474 are coded along with the product codes. 90734 for meningococcal conjugate vaccine, 90715 for Tdap product and 90672 for influenza virus vaccine quadrivalent live intranasal use. I hope you understood. Whenever we are coding 90471, 90471 should be coded only once and remaining vaccines should be provided with add-on codes only. Whenever an intramuscular and intranasal vaccine is also coded, it is need not mandatory that 90473 should be coded because there should be only one initial first administration code whenever we are using 90471. The rest code should be add-on codes only. That is why we are using 90472 and 90474. So let us see one more last example. A 6-month-old patient presents to the office for her routine checkup and receives vaccines and to receive vaccines. The patient is due for Tdap, pneumococcal, hepatitis B vaccines. During the examination, the physician finds an upper respiratory infection and fever. And the physician counsels the parents on the vaccines but decides to defer for 2 weeks. And the physician completes the well baby checkup on that day. Patient came for preventive visit and is due for vaccines and the physician has provided counseling also. But the patient has as upper respiratory infection and fever. So the physician did not administer the vaccines in that well child visit. 2 weeks later, now we are considering the second visit. 2 weeks later, the patient returns. Patient is afebrile and asymptomatic and is seen only by the nurse. Here physician is not there and is seen only by the nurse. And no counseling is provided in the second visit. The Tdap, pneumococcal and hepatitis B vaccines are administered. Patient age is less than 18 years, but counseling is not provided. So in this case also you need to use 90471 series. So T3 vaccines are coded. Whenever 90471 series is used, you will not take into consideration the components. So there is only one component for Tdap. Tdap, pneumococcal and hepatitis B. So for first vaccine, 90471 is given for first vaccine. Let us consider Tdap, 1 unit of 90471. Additionally, two other vaccines are also administered, pneumococcal and hepatitis B. Two add-on codes, 90472 into 2 units, one for pneumococcal and one for hepatitis, followed by product codes, 90700 for Tdap product, 90670 for pneumococcal product, and 90744 for hepatitis B vaccine product. Hope you understood the vaccine coding. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.